Bismillahirrahmanirrahim. Today we are going to discuss a very basic yet very important concept in manual therapy that is called as FRS, which means flexed, rotated and side bend. Now this is very easy to understand, but it is very technical to remember. So let's try to discuss it in a bit more detail, that what is meant by FRS. Please remember that we can identify the fault or the problem in a vertebra on the basis of two things. Number one is called as the positional fault, which is termed as either the FRS or the ERS, and on the basis of motion restriction. Now these are two separate domains. I'll repeat. One is called as on the basis of position of the vertebra, which is the positional fault, and the second one is on the basis of the restriction of motion between the two vertebrae, or let's say a number of vertebrae. Now what we assume, what will happen if a motion segment is normal, that with flexion there will be opening of the facets and the spinous processes and the transverse processes will move apart equidistant. Now they will move apart equally on the right and on the left side. This is what is happening in a normal vertebra, or in a normal motion segment. But what happens if a vertebra is flexed, rotated and side bent? It means that upon extension, either it can be active or it can be passive. Now when a person is performing the extension of the vertebra in a normal situation, what happens is that the spinous processes, they approximate, and the transverse processes, they also move equally or equidistant from their resting position, and they get approximated or they come close to each other. This is what is happening in a normal vertebra. But when a vertebra is flexed, rotated and side bent, then the spinous process will not move, number one, or there will be hypomobility of the spinous process of that particular motion segment. This will be the first indicator that the vertebra is not coming into extension. So now please pay attention that because the vertebra is flexed, hence the motion restriction is extension. So the motion restriction is always opposite to the position of the vertebra. So if a vertebra is flexed, it will not come into extension, number one. Flexion and rotation. Now we will try to see the side of concavity. This is, let's say, right side concave. So right concavity. So it is side bent to the right, and if it is rotated to the right, then the transverse process will be very prominent, or it will be very obvious. So now if you see the position of this vertebra, that this vertebra is flexed, rotated yet side bent. So I have exaggerated it. So here you can see this is the position, and it will not go into extension, left side bending and left rotation in this particular case. So remember that when the position of the vertebra is described, it is described as either flexion, rotation or side bending, FRS, flexed, rotated and side bent, and the motion restriction is totally opposite to it. So now we will also discuss in the same video what is meant by ERS. If a vertebra is extended, it means that the distance between the two spinous processes is already reduced. So it will be like this between the two vertebrae extended, and then we will see the side of rotation. Rotation is towards the same side that is prominent, and then we will see for the side bending, let's say in this case it is left side bended. So now it is extended, left side bended and left rotated. So the motion restriction will be flexion, right side bending and right rotation. So how you are going to fix this depends on how you approach the patient or what is the clinical condition of the patient, but normally you can fix this with the help of either the muscle energy techniques or with the help of spinal thrust joint manipulation. So one key to remember right now is that you always keep the dysfunctional side towards the bed. Like for example, if the prominent side is right, so you will keep the right side towards the bed and the left side towards the ceiling. So the side that is towards the ceiling, for example, if I tilt it like this, you may see that this will be cavitated first, this facet will be cavitated first, though this is the dysfunctional side. So then you can turn the patient to the opposite side and you can repeat the procedure on the other side as well, and you can apply the muscle energy technique based on your physical examination. I hope that the concept of FRS and ERS is clear to you guys, and if you have any question or any suggestions, please do let me know. Thank you very much.